afternoon. My name is Cassie. I'm going to be doing a head-to-toe assessment. What is your name, sweetie? Olivia. How old are you? You're 3? I can tell. Do you know where you're at? Are you getting a head-to-toe assessment? I have got consent from her parents and verified that it is her. You want me to take your shoe off? You good? Okay, so I did the mental assessment. I'll just start talking while she's doing that. I verified the name, day, the place. Her overall appearance is good. Her hygiene, she, is alert, oriented. Her thought process is within normal range. I'm looking at her skin. I can see that everything, her skin tone, everything looks good. Her nails, everything looks great with those. I can see that it's warm and dry. Her skin turgor is good. Her bony prominences. There's no apparent signs of edema. There's not any kind of skin integrity that is diminished. Everything looks really normal on her. Next, I'm going to start, because it is a head to toe, so we start at the head, we go down to the toe. So I'm going to start with her head. Her head looks normal, normocephalic. There's no bumps. There's no lesions. She didn't have any kind of lice or anything. Her hair is clean, dry. I don't see any kind of alopecia. Can I look up, sweetie? Yeah. Everything is midline. I mean, her nose, everything looks proportionate. Can you smile? Can you frown? Perfect. I did check, I'm not going to go through all of them. I did check her cranial nerve 7, her facial, that's intact. Next, I'm going to have her close her eyes. Close your eyes like this, squeeze. Perfect. By doing that, I checked cranial nerve 5. Can I get you to clench your teeth like this? Can you open your mouth? Close it. Perfect. That was the cranial nerve 5. It is also intact. I did also check for TMJ to see if there was any kind of dislocation. It looked great. Her eyes, before she came in here, I checked on the Snellen chart. She does have 20/20 vision. She did not. Her cranial nerve 2 was also, we checked that. It was the optic nerve. It was intact. I'm going to look at her eyes. I'm going to make sure they're symmetrical. And then I'm going to palpate her lacrimal apparatus. I'm going to push down to make sure there's not any, pull down to conjunctiva sclera. There's no abnormalities. Hey girl, you do really good. I did check her direct responses and her indirect responses and her accommodation. Watch this. Perfect. Everything looks great with that. She looked away. I did check her 6 cardinal fields of gaze. All of that was normal. Next, I'm going to check her ears. I'm going to look at her ear size. I'm going to make sure they're symmetrical. I'm going to check the tragus. And I see that there's no excessive earwax or any kind of discharge or anything going out. There's no redness. And I will ask her, do you have any kind of pain? Does that hurt? No, perfect. Okay, then next I'll do the whisper test, and I'm gonna go behind her and do that. Do I just leave her on the table? Will she be okay?
Yeah, she's fine.
Okay. Can you hear what I said? Okay. We did this all before, but I'm just showing that we did the whisper and the Weber test before. She did really good with that. I covered this ear, did it earlier, covered this ear, did it earlier. It was great. Then we did the Ryan test, did it over the mastoid process. We make sure when we click it that she hears, no longer hears more. We're checking for the air conductivity. It should be twice as long for the bone. And we did check her central, her cranial nerve 8 to make sure the acoustic was intact. Next, I'm going to check her nose and her sinuses. Okay, can I look at your nose? Perfect. They're symmetrical. I don't see any kind of lesions. I'm going to palpate the frontal maxillary sinus. Is there any tenderness? Does it hurt? No? Okay. It's patent. There's not the nares. Everything looks normal. There's no sign of deviation. There's no sign. Everything is midline. It's pink. The mucosa is pink. There's no apparent drainage. Can I get you to open your mouth, sweetie? Say, ah, perfect. Her lips are moist, pink. Can you smile? She can smile. Everything looks present, clean. Her hard palate is white, her soft palate's pink. When she did she moved her, it was midline. And normally I would take like a tongue depressor and I would put it down to check the cranial nerve 10, but she doesn't like that when we did it earlier when we practiced. Can I get you to swallow? Big girl. Cranial nerve 12 is intact. She had no problem swallowing. I'm going to look at her neck next. There's no apparent swelling, lumps. There's no, her lymph nodes. Everything feels great. Her tonsils, when I looked, those looked great. I don't feel any kind of swelling, anything abnormal. I did palpate her thyroid and carotid artery. There's no masses. This is Jody's. Okay, everything sounds normal with that. Okay, next I'm gonna look at her arms, her hands, and her fingers. I kind of did that earlier, but I'm gonna do more detailed. Can I get you to shrug your shoulders like this? Perfect. Can I get you to move your face side to side? Perfect. By doing that, I checked her, I was checking her accessory intact. I am gonna check her radial pulses, her upper extremities. I'm gonna make sure that her capillary refill is less than 3 seconds. Does that tickle? It does. And normally I would do this for like a full minute, but I'm just gonna do it like I've already just saying I did it. I'm gonna next look at her thorax area. I'm gonna make sure chest expansion when she's breathing. I'm gonna make sure it's symmetrical. Can I get you to breathe real deep? Okay. Take a deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Perfect. Everything sounds good. I did not hear anything abnormal. We also, I'll get behind her and then can I get you to say 99 when I get behind you? Is that okay? I'm just going to kind of turn you a little bit. Okay. Can you say 99? I feel the vibrations. Say it again, sweetie. Good girl, thank you. Okay, I did hear it. Everything sounded great. She doesn't have any kind of labor breathing. There's not any kind of use of additional accessory muscles. Everything, chest expansion, everything is symmetrical. I I did auscultate. It was clear and present in all fields. I did not hear any other sounds. Next, I'm going to check her cardiovascular system. I'm going to check her, I'm going to inspect the fifth intercostal space, midclavicular. And normally I would do this for a minute. And I'm also palpating it too. I palpated it, so. Okay, and then I'm gonna check the aortic, the pulmonic. You okay? And then I'm gonna check the tricuspid and the mitral. And no abnormal sounds were detected in those. Are you okay? Are you getting tired of us practicing on you? We're almost done. After that, I'm gonna look at her abdomen, and I'm gonna inspect to make sure there's not any kind of sites. I'm gonna look. Can I pull your shirt up? Is it okay? Okay. I want to check her umbilicus. I want to make sure that it's midline. I'm going to check all four quadrants, make sure that the bowel, everything looks good. First, I want to auscultate on those. I'm almost done, okay? Your stomach's growling. So, there wasn't anything, everything sounded right. I mean, okay, her bowel sounds were present in all four quadrants. They were not hypo or hyperactive, so it sounded good. And then after that, I would percuss, and I would do a lot, palpitation to make sure there's not any kind of guarding, which there's not. Is your tummy hurt or anything? No? Good girl. Next, I'm going to check for her legs, her feet, and her toes. I'm going to make sure that there's not any kind of edema. I'm going to inspect to make sure the color is good, the temp is good. I'll palpate the dorsalis and posterior tibial. Make sure the cap refills are good. I like your toenail color. That's pretty. And then, can I get you to push your feet? Big girl. You're such a big girl. Everything looks good. Her toe refills look good. Her pedal push is good. Both of them bilateral. Her heel to shin. I'm gonna take this. Okay, can I get you to? Yep. Okay. She did, her reflexes were intact, so everything was good on that. I did check the patella and the Achilles, and I would do that twice, so all of that was great. I'm going to look at her, I looked at her, made sure there was no edema. There was no, for posterior, for sacral, there was no edema, no apparent break in her skin integrity. Looks good with there. Done everything. I don't know if I'm missing anything. Can I get you to walk? Did y'all do that? Okay, so beforehand we did a balance test, which is a Romberg test. We made sure that her arms were out, her eyes were closed. She's not really wanting to do that again because we've already tried it so many times. She didn't have any kind of sway. She was walking great. Her gait was steady. She had good posture. And then afterwards, if she was in the hospital, I would make sure the call out was in reach. I'd make sure that, parent was present or whatever else. asked the parents if they had any questions or if there was anything that they needed me to look at. And normally I wouldn't be this nervous, but anyhow, that's it. Thank you, Miss Olivia. High five. You did good.